I think the policy that I would push first with the most universal potential would be universal daycare, universal childcare. I think if you extend the public school process down to the early years, you accomplish a number of things. You make it easier for parents to work. You make it sure that kids are going to be school ready by the time they get to kindergarten age. You actually make it easier for corporations because that is a service that's already being provided by government that they don't have to pay their employees additional money to be able to afford. I think if there was one policy area that would begin to move us in the overall direction that we've been talking about all day today, it would be universal child care.
Yeah, I mean, I think that's a compelling case. And I would go with the healthcare route, right? I mean, because all of these are so intimately related, right? So let's make this a public. Let's make the public investment in the health and well-being of every person in the nation. And then once we do that, then we would start to see, I think, and much like with Mark's area, right? You start there, and then you start to see the ripple effects, right? How many billions of dollars do we spend a year on people not being at work, for instance, because they are sick, right? And so what does it mean that for a critical mass of Americans, their healthcare is tied to their employment, right? It was a really telling graphic at the beginning of COVID, looking at 10 or 12 nations, and it was like the number of people who lost access to healthcare when COVID hit England, right, was a single digit. When it hit Canada, was another single digit, right? But when it hit America, right, the 3 million people who lost their jobs also lost access to their healthcare, right? So in the midst of a global pandemic where people are getting sick, right, the pandemic forced 3 million people, right, to make some really stark choices about how they were going to continue their healthcare after having been laid off from after having been separated from the place that was their healthcare provider, right? So I think that to me is a really stark and troublesome dynamic, right? So I would start with healthcare.